Hello, I am Fabiola Molina, physiotherapist and expert in non-invasive neuromodulation Nesa. I am going to present the following case based on my clinical experience. On this occasion, a patient from the old clinic came to Nesa therapy and had been treated with us for years due to a coccyx fracture that generated chronic pain 5 years later. That is to say, the person had the coccyx fracture and 5 years later was still in chronic disabling pain with a lot of medication and was also a patient in the pain unit. This patient, who had been a patient of the pain unit for 5 years with strong pharmacological treatment, with blockages in the coccyx area and also with radiofrequency type therapies in the operating theatre, was unable to improve her pain, and we began to carry out Nesa therapy. All this type of incapacity also caused her sleep and anxiety problems, so we began to treat her centrally. But then we also treated the anxiety by putting the directional electrode on the handlebars, and we also treated the sleep. And as the patient's general mood improved, we were able to treat and put the directional electrode at the sacral level with Program 3 and Program 6 and 7. Program 6 initially improved the patient's quality of life because the pain decreased. But when we had a number of sessions, we had 10 or 11 sessions, we saw that the pain was stagnating. So we started to remove Program 6 and put more time on Program 7. And at this point the intensity of the pain also began to decrease. These patients with a long evolution, with very incapacitating pain, need a high frequency of sessions. They need to have 3 or 4 sessions a week, and as the patient improves, we decrease it, which is what happened in this case. This patient came to do more than 30 or 40 sessions with us, and then she needed maintenance. She came once a week or every 2 weeks or even once a month, depending on how she was feeling. It is necessary to take into account that the events that the patient has in the day-to-day stress, family problems, economic or work problems will directly influence this type of chronic pain, causing it to fluctuate over time. We need to give the patient tools, and this may be one of them, and advise them to make changes in their lifestyle, to try to alleviate as much as possible all this kind of fluctuation. Finally, we were able to improve the patient's quality of sleep. We were able to improve the intensity of her pain and her stress and anxiety thanks to the neuromodulation of the autonomic nervous system with Nesa technology.